Hi, I'm Dr. Ryan Downey, board-certified podiatric surgeon and podiatrist at Kaiser Permanente. As podiatrists, we see a lot of referrals for heel pain, and most specifically for plantar fasciitis. My goal today is to talk to you about the condition itself and some of the easy treatment options that you can implement to help to see some improvement. The plantar fascia is like a big ligament. It spans the bottom of the foot along the arch, starting at the ball of the foot and then tapering down and attaching in at the heel. Every step we take, the arch lowers. This process is called pronation, and it's our built-in shock absorption system through the foot. However, for it to happen, the arch must lower and the distance from A to B must increase. This increase in distance causes a straining, a stretching on the tissue. And if it happens too much or too often, can lead to microtearing and breakdown of the plantar fascia. This happens first, most commonly, where it's the weakest, which tends to be right where it joins to the heel bone. This results in significant pain, throbbing, and sharp soreness in this area. This inflammation of the plantar fascia is what we call plantar fasciitis. And because every step you take causes traction and straining on the plantar fascia, this is why it's so difficult for it to heal. The only time it really has an opportunity to rest and recover is at night. However, 6 to 8 hours while you sleep just isn't enough. And what happens first thing in the morning when you stand up is you get a very quick stretch on the tissue when you first bear weight, which causes straining and re-tearing. And it hurts. And the other thing is, all that healing that just occurred through the night has now been torn away. This is why it is so difficult to see progression and healing with this problem. Every step you take all day long continues to further the injury. With time, chronic pain and inflammation of the plantar fascia at the heel bone attachment site can start to trigger a bone healing response. This oftentimes results in a bony prominence formation, which is commonly called a heel spur. However, this is a consequence and not the cause of the problem, as heel spurs are seldom painful in and themselves. The good news, plantar fasciitis does typically respond to conservative care. However, it is slow to resolve and typically takes at least 6 to 8 months to fully heal, assuming that the proper treatment protocol is applied. Successful treatment of plantar fasciitis takes time and consistency. To first rule out other sources of heel pain is also important. But if you've already been diagnosed with plantar fasciitis, there are 3 key pillars to successful treatment. First is to soothe. We want to reduce inflammation and pain in that heel area via use of rest, icing, anti-inflammatories such as ibuprofen or Motrin, and also through potentially a cortisone injection. Using a frozen water bottle each evening and rolling it through the arch and around the heel is one successful way that you can do this. Secondly is to stretch. Stretching of the plantar fascia is very important. It is continuous with the Achilles tendon through the back of the leg, and to stretch these as a unit together on a consistent basis is very helpful. The more that tissue will give, the less likely it is to tear with each step, and so it can significantly improve your potential for healing. The way to do this is to stretch the Achilles tendon at least twice a day. And you do that by standing and leaning into a counter or up against the wall with the feet pointed straight ahead and the knee straight. You must keep your heel on the ground and lean the body weight forward with the hips until you feel that pull in the calf muscle and through the Achilles tendon. This should be held for at least 60 seconds and done minimally twice a day. Be gentle and deliberate with your stretching. Do not bounce. This can be done while you're brushing your teeth at least twice a day. You're just standing there at the sink anyways. Also, if you're having that soreness first thing out of bed in the morning, the other thing that's beneficial is to do a gentle stretch and a warm-up when you first are getting out of bed. Do this by rolling the arch on a soup can or a tennis ball. Do a light stretch by putting a towel around your foot and pulling it up towards your leg, and then stand up. You don't want to be walking barefooted, so try to slip into something that offers some support for you right away. And support is our third S. An arch support will help to hold the arch in place and thereby reduce the strain on the plantar fascia when you're standing and walking. There are many different types of arch supports available on the market. Some are over the counter, while some are more custom. The best one for you really is the one that fits you the best and also holds the arch in place effectively. These should be worn at all times, including even around the house. You really want to avoid walking barefoot or unsupported at all. There is a list of appropriate arch supports and inserts provided in the description below. The other factor to consider is the type of shoe that you put your arch support in. The shoe basically serves as a foundation for the device. And if your shoe is built like a marshmallow, your arch support is going to do this inside there and not provide the degree of control that's necessary. You really want a good, stable foundation to rest this upon so it can function optimally. A list of shoe recommendations that are available in the current market are also listed in the description below. If you follow these steps, you should see improvement in at least 6 to 8 weeks. The condition won't be all better, but it should be somewhat better. Remember, it takes 6 to 8 months for it to fully recover. If you still see no progress after 3 months, reach out to your primary care provider to refer you on for your next steps. Thanks for watching.